Kia ora everyone, my name is Melanie. I appreciate you guys having a look at this, taking time to come listen to what I have to say. So I guess, before I dive in a little bit before I dive into the presentation a little bit, I'll share a little bit about who I am so there's some context as to why I'm so passionate about the link between housing and health. So this presentation is coming both from my background in academia and my lived experiences with my mahi that I do at Sustainability Options. So I'm mahi for SO, and we run the Healthy Homes Initiative and a repairs maintenance program across the Bay of Plenty. In my role, I coordinate the repairs for our whānau, and I get to spend a lot of time in my day seeing and almost living the realities of how people's homes impact them in everything that they do, but especially their health. My educational background's from the University of Auckland, and it's in politics, history, and the public policy sphere, particularly in New Zealand. Through these two intertwined experiences, I've developed a really strong interest in the link between housing and New Zealand public policy. Subsequently, I did my master's dissertation on home ownership privilege and how that negatively affects renters. But what really motivates me is creating realistic, positive change here in Aotearoa. That's one of the key reasons that I chose to speak about this topic, not only because it's meaningful to me, but I believe that there's super significant value in it for anybody listening, and really for the entire population of Aotearoa and generations to come. So for the next wee while, I'll talk a little bit about how where we live truly shapes how we live. Poor housing is not just an economic issue, but it's a human rights issue and a health crisis here in Aotearoa. I'll start quickly with overviewing the history of housing and how that has led to the current state that we're in. I'll then speak a little bit on the health impacts inadequate housing has, the widening of inequities it's creating, and the economic cost it's having on Aotearoa. I'll wrap up with some solutions that I truly believe, to help shift Aotearoa towards moving away from the rhetoric that housing is a commodity, but truly encompasses it as a human right. I'm looking forward to sharing my ideas. So I guess with that, I'll get started. So why does housing matter so much? Where we live shapes how we live. Housing is more than just shelter. It's the foundation for health, for dignity, and for thriving communities. But here, in New Zealand, too many of our homes are making people sick. Housing is the biggest overarching link between so many aspects of our lives. Not only is it physical health that is so crucially linked to where we live, but also to our safety, our mental health, job, school performance, attendance. Safe, warm, and dry homes are required to support necessary social and health outcomes. Inadequate housing in Aotearoa is intensifying both the negative health and social outcomes for those people who are living in them. It is widely recognised through research that improving poor housing conditions reduces health inequities across social, disadvantaged and ethnic groups. Yet continuous New Zealand governments ignore this and continue to embed these inequalities. Substandard housing is a major public health issue in New Zealand, and it warrants urgent policy attention. But this isn't some new phenomenon. Historically, there have been very, very few government policies aimed at addressing the standard of existing housing in New Zealand, but rather they favour financial policies, promoting home ownership, and in turn, neglecting policies that regulate the quality of existing homes. Housing conditions within the growing settler society were unequal, and land was commodified. It was an object for profit, not a collective resource for wellbeing or security. From as early as the 1850s, Māori were being dispossessed of their whenua and subsequently from home ownership, which is still reflected in numbers of home ownership today. During both the 18th and 19th century, housing policy focused on housing as a fundamental need, with many state housing policies prioritising affordable, stable and quality housing. But it's important to note that although the policy was aimed at improving the quality of the housing, it wasn't for everybody. It was for settlers. However, in the 20th century, governments took a big 180-degree turn and moved towards market-led approaches. Consecutive governments began instead putting finance towards assistance for Pākehā to build their own housing, neglecting both Māori and renters, despite the fact that in 1921, 41% of households were of the rental tenure. This shift away from quality state housing and attitude towards home ownership being privilege was further tempered by the Victorian belief that some people were, and still are, more deserving than others. I, along with many other scholars, would argue that these neoliberal agendas, financialisation and the deregulation by governments in the housing sector, has contributed to the environment where affordable and adequate housing is so unachievable for many. Really, until 2007, the government withdrew entirely from the housing field. The UN Human Rights Office declared in 2017 that housing, not only in Aotearoa, but worldwide, has been transformed by global capital markets and finances, especially following the 2008 world financial crisis. So these 4 photos here, you see here, they're a pretty stark reminder that, and this is the reality that's still facing many whānau in Aotearoa, houses that are cold, damp, and unsafe. This is where history meets the present. Housing is a human right. It's not a privilege. Even our own New Zealand Human Rights Commission has declared that a decent home is a fundamental right. Yet, the reality is pretty sobering, with a third of homes being self-reported as still being too cold on a winter's night. The right to adequate housing is actually not specifically provided for in any New Zealand legislation, highlighting a huge gap in accountability for state responsibility. Internationally, the right to adequate housing is an obligation under UN treaties. The UN Human Rights Council Special Rapporteur has called on governments globally to ensure that policies are serving housing needs rather than investment priorities. It's a good reminder to nations that they are first and foremost accountable for human rights over profit. Importantly, though, the right to adequate housing is not to be confused with the right to home ownership. The right to an adequate home intends to ensure that everyone has a safe and secure place to live. Whilst everyone legally has the right to adequate housing, it is important to recognise that over generations we have built a system where not all groups or individuals have that same degree of ease of obtaining them. The UN Office of High Commission exerts that the government needs to be paying particular attention to people living in vulnerable conditions and subsequently tailor their housing policies for those most in need rather than for priority groups. But as you'll see in the next slide, that is not the case. So the current state of housing in Aotearoa. Cold, damp and overcrowded homes are all way too common. In 2019, an estimated 50% of renters felt powerful enough to report problems with dampness and mould. And Statistics New Zealand showed that in 2022, 1/3 of houses in New Zealand are still too cold on a winter's night. But those are self-reported numbers. Realistically, that is far greater. The reality of what I see on a day-to-day basis is that about 90% of whare in our district are too cold due to a combination of factors. When referring to cold, I'm speaking about homes that can't maintain 20 degrees overnight. 20 degrees is the World Health Organization's recommended temperature for vulnerable individuals, such as children and elderly. A home being able to maintain 20 degrees overnight helps protect against respiratory, cardiovascular, and other health conditions, all linked to cold indoor environments. For many whānau we journey with, it is impossible for their whare to maintain 16 degrees overnight due to the conditions of the home that they're living in. And when sleeping in indoor temperatures colder than 16 degrees, blood vessels begin to constrict, trying to preserve our core body heat. It slows down our bodily functions, increases the heart rate, and increases risk of severe complications such as strokes and heart attacks. It wasn't until the 1991 Building Act that a lot of adequate housing practices were put into law. And it wasn't until 2008 that all homes being built in Aotearoa must now have an underfloor insulation. And it wasn't until 2008 that homes in New Zealand had to have ceiling and underfloor insulation, only about a century and a half too late. 1.3 million homes in New Zealand were built before the building code was introduced. And since the law was introduced, only about 400,000 homes have been built across the motu, demonstrating just how old and inadequate the majority of homes in Aotearoa are, especially homes that vulnerable people are living in. Despite 2/3 of New Zealand's housing stock being built prior to the code, there has been no shift in national requirements being applied to all of these older homes. OECD data argues that housing prices and finances have played a really large role in the poor housing quality in New Zealand. We have built a system that favours the financial value of housing, while the social value, arguably the most important, has become a very, very distant second. Poor housing drives our high rates of asthma, respiratory illnesses, and infectious disease. The link between cold, damp, mouldy housing and poor health has been highlighted in several international and New Zealand studies. Houses that are cold and likely to be damp lead to an increase of respiratory symptoms. Moreover, in Aotearoa, there is a tendency to crowd together in one room overnight to stay warm, which is only on the increase with the rise in cost of energy, which promotes the transmission of viral infections. New Zealand has the highest rate of respiratory illnesses in the OECD, with 82,000 hospital admissions annually. Research by Howden Chapman at the University of Otago has directly attributed these illnesses to substandard housing. Not only does inadequate housing drive respiratory illnesses and infectious disease, but also asthma. New Zealand already has one of the highest asthma rates in the world, with more than a quarter of children and 1 in 6 adults suffering from asthma. Asthma has conservatively been estimated at costing the New Zealand health system over $800 million a year. It's widely noted that children in cold homes have higher hospitalisation rates, which are preventable. 28,000 children in Aotearoa are hospitalised each year and have been identified as preventable if they were living in adequate homes. Not only is inadequate housing a contributing factor on missing school and work, limiting future opportunities, but it is also shown to worsen stress and decrease mental health. So I wanted to share this quote from a whānau that we here journeyed with, because I think it can better explain than I can, that housing isn't just related to our physical health, but literally our whole entire lives. For some context, this is a working mother of 6 who lost her job during COVID, and they had to move back to their family land and into a makeshift home just to make ends meet and to be able to survive. When you came in, I was on the verge of giving up on life, and you gave me hope. That's what you did. You came in and you gave me hope. It wasn't just about my home. I was on the verge of saying goodbye to my babies because I couldn't do it anymore. And that's what I needed most. Someone to come in, help me out of the shit pit that I was inside my mind, that I couldn't do it anymore. And that was you. So historical ideas about home ownership being the primary tenure, they've lingered and especially shape how renters are viewed and the limited power that they hold in the policy space. But it's not only renters who are treated inequitably in housing policy though. Māori and Pasifika whānau are disproportionately in overcrowded, cold and damp homes. Advocating for equity means ensuring that safe and adequate housing is available to all communities. Colonial housing policies over time have excluded many, and we see the systematic inequities persist. There have been very few government policies aimed at addressing the existing housing stock standards, with many now believing that living in a healthy home is both aspirational and unachievable. These 2 photos are from a home that's literally less than 2 minutes from where I'm sitting today. These unhealthy homes aren't just in rural communities, they're in our own backyard. They're our neighbours. where people live isn't as simple as a choice, and that's why it's so important that policy inaction when it comes to all homes needs to end. So now let's talk about what this costs us as a nation. Cost-benefit analysis clearly indicates that housing improvements save public money. Not including asthma, poor housing is draining our health system. Every year, more than $150 million is spent treating illnesses that are linked to cold, damp and overcrowded homes. That's $150 million of spending that's preventable. It includes $35 million in hospitalisations and more than $2.3 million in emergency visits. The irony, though, is that investing in better housing saves us money. The Healthy Homes Initiative has already saved us over $10 million in children's health costs alone. The evidence is clear. Prevention is cheaper and more humane than cure. Yet too many homes remain well below the minimum standards stated in the Healthy Home Standards. Not only does unhealthy housing in Aotearoa have an economic cost on the health system, but it's deeper than that. Unhealthy housing has a cost and loss of productivity as well. Inadequate and overcrowded housing fuels stress, anxiety, and depression. Living in inadequate housing chips away at people's well-being. So of course, the true cost of inadequate housing isn't measured in dollars. And of course, these costs are disproportionate to vulnerable groups and systemic inequities. But ultimately, it's the 1,600 deaths each year linked to their homes. It's the child admitted to hospital again and again for asthma. It's the parent who must choose between heating their home and feeding their family. It's the father who can't keep his job because he needs more than 10 days of sick leave. It's the older person whose health declines much faster because their home is cold and damp. It's the nan who gave up her whare and moved into the shed so her moko can be warmer than she is. It's the teenager who never made the NCA exams because they're sick again. It's the whānau that can't stop living in the stress of when their roof will give away. These are everyday realities for far too many Kiwis, and I'm reminded of this on a daily basis. But these, again, are avoidable tragedies, and they remind us that housing policy is health policy. So some simple interventions pioneered through ECA have provided grants for insulation and heating for homes built prior to 2008, and they have been proven to reduce hospital admissions for both children and adults. Investment in housing reduces long-term costs. For example, the Warm Up New Zealand Heat Smart program was allocated $340 million, and its impacts were analysed to have had a net benefit of $951 million. And those benefits aren't just for the government bank account, but they're actively improving people's lives. Retrofits and insulation programs are essential for the well-being of Kiwis. But by limiting these programs, an opportunity has been missed, as savings in hospitalisations alone far outweigh retrofit costs. The Healthy Homes Initiative is proof that investment does pay off. The relationship between housing and safety is also super critical to mention briefly. Injury and the condition of housing is well established, with over 500,000 Kiwis suffering falls and requiring medical treatment in their own homes each year. So I wanted to pick a case study, but honestly I couldn't pick one because every day I talk to a whānau or organise a repair for a whare that is in desperate need of help. So I will link the video, not to shamelessly plug our mahi, which I could do for days on end, but because I want you guys to try and imagine what benefits could be done across the motu if the government worked with people directly affected by inadequate homes and implemented universal housing quality standards and policies that both uplifted and benefited the people living in unhealthy homes. Because if organisations like ours can make this difference, and like yours, imagine the scale it could be done on if the government invested in decent housing policy for all. So in my dissertation research, I focus a lot on the policy ideas that would pose as solutions and a way forward for better housing policy in Aotearoa and subsequently better health. So what can we do? We already have basic foundations and the start of a shift in momentum with the Healthy Homes Standards and the Healthy Homes Initiative. But these must be fully enforced and expanded. Alone, they're not enough, as there is no regulation, there's uneven enforcement, and it does not account for vulnerable groups who are not in a position of power to challenge either their landlord, their whānau, or the government. So my policy recommendations would be as follows. Stronger enforcement of housing standards, something along the lines of a warrant of fitness. Education on what healthy homes are and their importance. Running community workshops, integrating this into the classroom. 3. Retrofit all old housing stock. Open up the Warmer Kiwi Homes Initiative to all homes built before 2008. 4. Stronger integration of health and housing policy. Reframing what housing means to Kiwis. 5. Prioritising equity across vulnerable groups. And 6. Centre Māori and Pasifika communities in designing solutions that work for them, by them. So to conclude, the OECD has highlighted that New Zealand lags far behind comparable countries in housing quality. And the New Zealand Medical Journal shows that many homes would fail to meet even the most basic standards for warmth and dryness. The solutions are often simple and they can be done. Education, insulation, proper heating and ventilation can dramatically reduce hospital admissions. So if you took only one thing from my presentation today, I'd like it to be a deeper understanding that ultimately housing is healthcare. They're one and the same. Every dollar spent on making homes healthy, it saves lives, saves money, and builds a stronger future for the communities that we're living in. No child should get sick because of the home they're living in. That's a line we have already crossed, but we have the power to change it. Aotearoa must commit to decent housing policy for all, as a matter of justice, health, and dignity. We need to stop treating unhealthy housing as a norm, or an inevitable, because it's neither. It's a choice, and we can make a different one. Healthy housing is not only possible, it's urgent. It's the foundation of wellbeing. So let's commit to ensuring every person in Aotearoa can live in a home that supports rather than undermines their health. It's not just about comfort, it's about survival. So thank you for listening to me today. Ngā mihi nui. Thank you.